Can you all hear me all right? If you can't, just raise your hand and I'll make sure I speak up. Sorry for knocking everything over. Bull in a china shop. I didn't think I'd need to apologize for my Twitter account, but Ms. Saunders, I'm very sorry. It's just a real mess these days. Thank you for having me. Thank you for being here. Thank you so much to CNA and NNU and DSA. Last time I was in Sacramento, I met the Harlem Globetrotters for some reason, and this is much more exciting to me personally. I really appreciate y'all being here. I've been driving around the U.S. talking to folks about healthcare and health inequity. I know after my talk we'll do some Q&A. I would love to A, any Qs you have, but I hope y'all can help A, my big Q, which is that I really want to understand, and I really need to understand health injustice from the ground up. And so your stories and anecdotes and testimonials are really, really essential to me. Also, by way of disclosure, I am, for not much longer, a computer toucher employed by an insurance company. Obviously, nothing I say represents them or vice versa. This is just my atonement for participating in capitalism. So thank you for understanding. And if that bothers you, fantastic. It bothers me too. I'm quitting in 3 weeks. Fantastic. And while we're in the subject of grievances, I have one of America's worst case of dry mouth right now. So if I drink water really dramatically, just kind of roll with it, please. I'll try to keep my mouth ready to go. Great. I said earlier I want your stories, and that's because healthcare is local. Health disparity is local, right? There's a world of difference between health needs between parts of North Brooklyn and South Brooklyn, or Boston and Birmingham, or Los Angeles and Little Rock, or Bayview Hunters Point and SF, and Russian Hill Hunters Point, or Russian Hill and SF. And I really want to know more. I've traveled up and down America to understand health inequity on the ground, to understand it not just from papers and essays, but from my eyes and my ears and my heart. And throughout it all, I've just seen so much suffering. I've been welcomed into families thrust into inescapable debt because of complications from pregnancy. I've met the children whose birth caused that debt, children born into that debt and who will probably carry it all their life. I've sat with widows and widowers, people who have watched those whom they love agonize and who, out of love, spent everything they could in an attempt to ameliorate that agony and who failed, or who were failed, and now carry themselves in both heartbreak and poverty. I've met folks who were born into bodies which suffer. I've wept in front of them as they share with me the depth of the dehumanization forced upon them, whose daily existence is a constant blaring reminder that they are not wanted and who are forced to make an occupation of begging over and over again for basic help. And I visited the wealthy hospital campuses for wealthy hospital patients, virtual islands in the middle of their cities. And I visited the neighborhoods around them, usually neighborhoods of color that have been systematically drained of capital and labor in a dance reminiscent of colonialism. I've met people who, too poor for that hospital, in fact, immiserated by that hospital, suffer and die much, much sooner than the people of wealthy neighborhoods, even a few miles away. And I've listened with white knuckles to people, elected people, who have been given the opportunity to assist those who need them, the opportunity to ease the burdens of their constituents, but who have looked time and time again at the opportunity and said no, who have privileged their own financial reward over what's a simple moral duty. And over time, I've felt my own body betray me. I've looked at myself in the mirror and seen my own coming crisis. I've paced miles and miles around my own little city block, fearing the decay of my own temporary able-bodiedness and the wave of punishments for the sin of being sick, in which I inevitably am going to drown. Here are the contours of the world American health finance has given us. 1. America spends more than any other country on healthcare, almost twice as much per capita as the next highest spender, while caring little to nothing about community health, caring little to nothing about population health, caring about that which cannot be packaged and sold. 2. 75% of our spending goes to chronic conditions that are preventable, yet nobody footing the bills has really tried to prevent them. And 3, our system of for-profit private insurers literally takes money from poor people and gives it to the rich. It is negatively redistributive. In 2014, it pushed 20 million people into poverty, or from poverty to extreme poverty. But it does not do justice to the folks that I've met to simply pornographize their suffering. It is insufficient to simply recite a litany of human pain. And so I'm here to honor those who have shared their suffering with me in the long, long hope that we all together can build the better world in which nobody needs suffer as they have. But I can't give you a quick fix, because there is none. There's no technical magic by which we destroy this hateful machine overnight. But I can, I hope, offer you a vision, an aspiration, an understanding of the tools by which we may build together this better world. And so if you permit me, I want to talk about 3 things: what we have, what we want, and what comes next. I want to talk about the overwhelming and numbing brutality of for-profit healthcare. I want to talk about the relatively benign structural changes that we demand instead, and then I want to talk about something bigger, a broader vision of that better world, the moral compulsion of health justice. Does that sound good? Yeah. Great. So I want to start off by confirming something you probably feel in your bones, which is that you are being made to suffer. You are being exploited, and the method by which you're being exploited, or the severity, or the complexity, or the artfulness of the cover-up varies from person to person, but fundamentally we live in a world in which you are made sick and then punished for being sick so that somebody else can turn a profit. Let's talk about why. Now, by and large, the costs of receiving healthcare are much, much more than any individual person can afford by themselves. But not a lot of folks need a lot of healthcare in a given year. In a given year in the US, 50% of all medical costs come from 5% of the population. 80% of all medical costs come from 20% of the population. And those are fungible populations. They move around. Maybe some years you have no health needs, and another year you suffer a trauma, have a heart attack, get hit by a car, give birth to a premature child. And so when the costs move around and hit you, they can hit you pretty hard. And if everybody had to pay all of their own medical costs out of pocket, eventually millions of people would go into crushing debt and medical bankruptcy. That's not a guess, that's history, because out-of-pocket costs used to be the primary way we funded healthcare. And it wasn't until a bunch of socialists and a bunch of unionists and a bunch of doctors and nurses insisted that letting folks go into poverty because of illness was immoral that we shifted to a new payer model, and that's the idea of insurance. Insurers are organizations, or in the US, companies that receive revenue by charging you monthly premiums. When someone gets sick, insurers spend some of the money they take from everybody to pay off a portion of those healthcare costs, plus keep a profit for themselves. Thus, the more revenue an insurer receives from customers, or realistically, the more subsidy it receives from public money, the wider those costs are spread, and the lower the insurer's per-person costs. That's called a risk pool. But if an insurer has too few healthy people, or too many sick people, for example, if it gets just one person with hemophilia, whose care can cost up to $1 million a year, its per-person costs really increase. So to compensate, it increases premiums. But when premiums go up, people who can't afford them drop out. Unless, of course, they're sick and can't afford not to afford those premiums, they stay on board, so per-person costs skyrocket even further, so do premiums. It builds this big, stupid Ouroboros of misery. Thus, an insurer wants as large and as healthy a risk pool as possible, or it wants to find ways to kick out sick customers or coerce them into leaving. Maybe it drops coverage for the drugs that sick people need, or cuts off access to the providers who are located near the sickest patients. Because the task of an insurance company, at the end of the day, is just to make sick people, as much as it can, somebody else's problem. That's what we mean when we say that we live in a world in which healthcare is a commodity, right? Because basically the future's on your heart and the future's on your lungs and your chance of getting diabetes and whether or not your Mima's glaucoma gets better or worse before she goes on Medicare are fiddled with and speculated about and bought and sold for profit by private companies. And this fragmented, commodified healthcare model views healthcare as a transaction between corporations instead of a relationship between a person, their body, their community, and their doctors. That's perverted. We've just mistaken the profit motives of insurers for healthcare. And over time, we've delegated the responsibility of providing insurance to employers. That's messed up too, because that results in a status quo of total employer domination, in which your access to things like contraception or blood transfusions or hormone therapies are determined by the whims of your employer. But if you aren't lucky enough to have an employer, if you lack these so-called better skills to get one of the finite numbers of better jobs, you're just left behind. And so the people who profit from the commodification of our bodies have decided it is acceptable to shackle the well-being of children to whether or not their parents were lucky enough to have gone back in time 40 years, learned to code, and found a benevolent employer. Welcome to the hell world of America 2018. Now it gets worse. It's way too early in the talk for things not to get worse. Because the costs of healthcare keep increasing, and they increase much, much faster than inflation. They've been increasing since we first began recording them. Part of that's because more people are living longer with chronic conditions. Things like heart attacks or diabetes aren't the death sentences they were even 2 or 3 generations ago. So we spend more money taking care of more people longer, which is a fantastic use of cash. But that's not the real problem, right? Most of these cost increases occur because hospital CEOs, equipment manufacturers, pharmaceutical companies, close personal friend Martin Shkreli keep finding ways to charge more and more money for the same services, or rack up fees for unnecessary services, and no private insurer can really stop them. Here's how that shakes out. In the US, the average inpatient procedure costs 40% more than the same procedure when performed in the same patient, but performed in France. Or take, for example, y'all know MRIs? MRIs are just big fancy computers that print money. And in the US, an MRI procedure costs 5 times more than the same machine doing the same thing when done in Australia. The costs are high because the prices are high. Or most egregiously, consider the relationship between primary care and hospitals, right? Now, primary care is a thing like basic checkups or basic medications, the kind of familiar, intimate healthcare you get from your family doctor. It's high volume, it's low margin, and it's generally not super profitable. But now conversely, a hospital gets paid an average of $2,000 a night for an inpatient stay. So if you're a hospital CEO, it just makes a hell of a lot more sense to push folks into inpatient admission instead of wasting your time and wasting your money letting them get cheap primary care outside the hospital. We witnessed this thing called Romer's Law, in which hospitals will change their admission policies to guarantee every hospital bed that is built is filled regardless of actual need in the community. Now, this means diseases will be caught late if they're caught at all, and people will get sicker and sicker and thus more and more expensive to treat. But so long as someone's footing the bill, the hospital's still getting paid. The hospital's specialists are still getting paid. Well, what's the result of that? Well, right now, 58 million Americans live without access to primary care. So as you can see, there are 2 fundamental truths to American healthcare. One, if you're a payer, like an insurance company, it's just not profitable to insure people who are sick. 2, if you're a provider like a hospital, it's extremely profitable to charge sick people as much as possible, as late as possible, so long as somebody's footing the bill. And so we've built upon these jagged rocks the loathsome church of American healthcare, in which the question of who deserves to receive healthcare and when, or rather, whose suffering matters, is determined by private profitability. Now, this whole scenario scares the bejesus out of everybody involved, particularly insurers, right? Insurers are interested in finding ways of not paying rising costs. Sometimes that means just refusing to pay for claims altogether. That's probably happened to you or someone that you love. Before the Affordable Care Act, it meant that insurers would often refuse to cover people who were likely to get sick. You all know the phrase pre-existing conditions. But it's still not enough to bring these costs down. So we all got together, everybody in America, back in the 70s, and invented the idea of consumer-driven healthcare. Now that's the idea you should make consumers, which is just a libertarian way of saying people, pay more for the costs of their own healthcare, right? That's why your deductibles and your copays go up every year. Because once you pay more for your own healthcare, you'll turn somehow into a smart shopper. And through the power of the free market or whatever, you'll shop around and not get unnecessary or too expensive care. You'll find the cheapest ER in town if you get hit by a car. You'll Yelp your surgeon, and somehow all this together will bring prices down. That's silly. We've just internalized the language of the oppressor, right? And all this builds an unambitious and honestly pretty lonely worldview of what healthcare is, what healthcare can and should be. It treats being sick, or being poor, or being able to get pregnant as a character flaw. And that means if you get hit by a car, or you give birth to a premature baby, or you have a heart attack, you're on the hook for your own costs. If we determine that yours is the wrong kind of suffering, and these costs force you into a lifetime of crushing debt or medical bankruptcy, so that a hospital, a pharma company, or your insurer can profit, well, tough shit. It's your responsibility. It's a matter of personal accountability. That's the brakes. Now, this market ideology of consumer-driven healthcare only serves people who seek to extract profit from our bodies. And you know what's worse than that? It doesn't even work. People who are forced to pay for healthcare costs they can't afford just don't seek healthcare. They don't seek primary care. They don't seek preventive care. They ignore that rash. Try not to think of that tumor. Think away that chest pain. Because we demand they bear the burden of costs they can't afford, they watch their bodies turn to time bombs until they have a heart attack at their jobs and leave their kids behind. So what do? How do you square the rampant increase in healthcare costs with the fact that insuring sick people just isn't profitable? Well, if you're the Democrats, you can collaborate with the Heritage Foundation to offer us the Affordable Care Act, which is, at its core, the massive subsidization of private companies with public money. The ACA is a big bargain, a big plaintive wail, right? Please, 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 how many billions of dollars do we gotta give you so you stop getting sick people off their insurance plans? Now, of course, the ACA had successes, first and foremost among them, the expansion of Medicaid. In places where Medicaid was expanded, we saw a 6.1% reduction in the mortality rate. That's 11.1% among communities of color. And we understand why, right? These are folks that have been systematically, if not violently, denied access to health care in the first place. Even the relatively meager expansion of Medicaid does a hell of a lot to help folks get basic and essential care when they need it. But it's not enough, because at the end of the day, costs keep increasing, quality of care stagnates or worsens for the most vulnerable among us, and 31 million people are still uninsured. The ACA has failed in its pursuit of health justice. And there are consequences for that failure. Because among so-called developed countries, it is America that is the most dangerous place to be sick. Among peer countries, America is the most dangerous place to be black. The most dangerous place to be pregnant, with the highest maternal mortality rate of any first world country, of which 60% are entirely clinically preventable. America is the most dangerous place to be a child. The most dangerous place to be a woman, the most dangerous place to be gay, the most dangerous place to be trans, the most dangerous place to be old, and one of the most dangerous places to be disabled. Last year, life expectancy at birth fell for the first time in almost 30 years by 1/10 of a year. Across the 4 million people born last year, that's a theft of 400,000 years. But a funny thing happens when you look at the data more closely, and you know precisely what I'm going to say. It is woven into the American fabric. When you look at the data more closely, you understand that all this danger only exists if you're poor. Because rich people are exempted from these problems. Men born in the wealthiest fifth of Americans get to live 15 years longer than men born in the poorest fifth. Among women, that gap is only 10 years. America has refused to recognize the essential dignity of being human, and in this refusal, it has caused mass suffering. This is war. This is the terrible secret of American healthcare. This is the fundamental American illness. They are killing us and robbing our corpses to foot the bill. This big, stupid, multi-payer, profit-driven Rube Goldberg machine of American healthcare is failing us today, and left unchecked, it will collapse tomorrow. That is incontrovertible. It will collapse. And so instead, we demand something different. We demand a federal, universal, single payer. Now, single payer is a pretty simple concept. Instead of having a bunch of private insurers with a bunch of fragmented customer bases, each seeking to pass the buck and avoid taking care of unprofitable sick people, we have one publicly funded, publicly owned insurer with a legislated mandate to offer and to cover in full all care for all people. Now, that phrase, all care for all people, is important. We don't want Medicare as it exists today, with carve-outs for private companies, cost sharing, no out-of-pocket limits. No, we want an improved Medicare that guarantees comprehensive coverage, medical, vision, dental, and long-term care for all people in America, including non-citizens, that is free at the point of service with no cost sharing. No longer will, oh, hell yeah. Second paragraph out. No longer will someone needing help be bound by Byzantine provider networks, for there is only one network. No longer must you decide between food and medicine because the medicine's being paid for. No longer will your care be dictated by who your insurer is because the insurer is Medicare. Everybody benefits when accessing care is free and easy. Delivering care, being a doctor, being a nurse, being a social worker, that's complicated. Bodies are big bags of goo we barely understand, and they hurt all the time. Making them suffer less is a complicated process, but paying for it isn't. Paying for it's pretty simple. In fact, people ask, how can we afford it? We're already paying for it. We're just forced to spend that money really, really stupidly. Right now, American public money pays for 2/3 of all healthcare costs in the U.S. Half of that 2/3 is direct Medicare, Medicaid, and VA spending. The other half of that 2/3 is just public subsidies to private companies. The remaining third is out-of-pocket costs, a kind of tax you pay to private companies in the form of premiums, deductibles, and copays. America is already spending the money required to fund single-payer. The insurance industry is incompetent, unable, and unwilling to pay its fair share, so it passes the buck back to you. And so the goal is to liberate people from medical costs while in reallocating all this spending, take care of everybody long-term. Part of the reason costs are so high is because private insurers, with their pretty small customer bases, just can't negotiate with hospitals. Right now, Medicare negotiates on behalf of 44 million people nationwide, and so they get better prices. You scale that idea up. By negotiating on behalf of 300 million people, Medicare can basically set fair prices for care while compensating providers justly. But even before that happens, we free up all the money associated with administrative costs and profit-seeking in the private insurance industry. This optimization, or in their terms, this innovation, opens up, in a conservative estimate, an additional $370 billion a year. With a hard B, that's $1 billion. That's a big chunk of change. Well, what do we do with it? Well, we use it to improve everyone's standard of living. We build or reopen primary care centers in rural areas. We fund community health centers in poor neighborhoods. And most importantly, we return the money to the people who do the work. Take, for example, y'all know home health aides? If you have a sick parent, sick kid, sick friend, a person can receive care in the hospital, but of course, that's almost $2,000 a night. Often, if a person has less urgent medical needs, they can receive care at home. Home's great for a lot of people for a lot of reasons. Home is where the dog lives. Home is where the internet lives. You already have food in your fridge at home sometimes. And that care costs about $120 average per visit, right? So everybody benefits. More humane care, that's much cheaper, we save money. Well, everybody benefits except for home health aides themselves, because for this essential labor, they're paid a nationwide average of only $11 an hour. So we can take this money and use it to do what the private market refuses to do, which is pay fair wages for essential care that helps everyone. Let me give you another example. I visited a hospital in Little Rock, Arkansas. And Little Rock's one of the diabetes capitals of the US. You leave diabetes alone for too long and you get things like cardiac failure and heart attacks. So people from all around the county came to this hospital to seek treatment for cardiac failure. But over a quarter of them will be back in the ER within a few weeks. And that's obviously not good. And so this hospital, which was getting penalized by Medicare for its high readmission rate, decided to find out a way to bring those readmission rates down. Now, who do you think affects readmission rates after you've been to the hospital? Is it the cardiologist or the surgeon? Is it the pacemaker or the $20,000 data package so nerds can monitor pacemaker metrics? No, they just get the bill the most. This hospital instead hired social workers and nurses to take folks in after surgery and guide them toward Medicare-sponsored exercise and social cooking classes 3 times a week. And their readmission rate fell from 26% to 4%. You see, it's non-diagnostic extraclinical care. It is compassionate labor, which really comes to the rescue. It is social workers, it is patient advocates, it is nurses. These are the folks who are chronically unrecognized and undervalued, and yet you're the primary drivers of population health. These are pretty basic ideas. These are pretty simple demands. We understand the social forces that help folks become healthy, and we understand the structural problems that make them likely to become sick. And in the face of this knowledge that population health is structural and social, knowledge we've had for literally decades, capitalism's response is to blame population illness on an aggregate of atomized and individual choices, and then package them into healthy lifestyles commodities, and apps and cookbooks and step trackers. But despite what app companies insist, there are no apps that bring about better health. A how to survive on $4 a meal cookbook is offensive and useless to somebody who only has $4, if that, per meal. Programs that penalize you for going to the ED at the wrong time don't do anything to make you healthier outside the hospital. But in the multi-payer private model, nobody's investing in population health. Nobody's investing in compassionate labor or paying compassionate laborers fairly. And they probably never will be. Because right now, your private insurer only bears the cost of you receiving care while they're insuring you. Because you're going to change insurers in the future, and God permitting, go on Medicare, they feel no pressure to provide you with care that keeps you healthy now or makes you healthier in the future. Let me put it another way. We know that if your window at home gets broken, the weather gets in. And if the weather gets in for too long, you get sick. And if you get sick or if your kid gets sick, you got to go to the doctor. And if the local clinic was shut down or it's booked solid, you got to go to the hospital. And if you got to go to the hospital and the hospital's far away or you don't have a car, you got to take the bus. And in a lot of parts in the US, if you got to take the bus, you got to spend all fucking day dealing with the bus system. If you got to spend all day dealing with the bus, you can't go to work. And if you can't go to work, you can't afford to fix the window that caused the problem in the first place. And so the answer is not to fork over a pile of cash every time you go to the hospital. The answer begins with giving folks what they need to fix the goddamn windows. But there are no private actors in the American model who will consider bearing responsibility for fixing these problems on their own. The insurance companies are incapable of addressing the foundational problems of healthcare, of fixing broken windows, of reopening the 18 rural hospitals that closed in Texas in the past 5 years, of repairing the PVC septic systems that have ruptured in South Carolina and brought hookworm back to the state in the exact same way that a billionaire is incapable of lessening income inequality, or a cop is incapable of shrinking the prison industrial complex. They cannot fix this injustice because they've been constructed by and within that injustice. They cannot solve these problems because they existentially cannot conceive of them as problems in the first place. But we can, and we do. And so it makes perfect sense that the same actor who suffers when people don't get care, which is all of us, united by our federal government, represented against suffering, should be the actor who pays for that care in the first place. Because once the federal actor bears the costs of providing care and the risks and costs of what happens when care is not provided, it can finally be used as a tool for realizing health justice. If your people are suffering because they don't have a place to live, or the places that they live are unsafe, there's water in the walls, there's mold in the ceiling, they're flammable, thinking of the Grenfell Towers in the UK or Ghost Ship back home in Oakland, then housing is healthcare. And you must build free, affordable, safe housing to bring healthcare costs down. If people are suffering because they don't have access to healthy food to eat, it's not profitable to sell a poor person vegetables, so they're getting diabetes and comorbidities like cardiac failure, then food is healthcare. And you must provide people with affordable and free food options and the time, space, and materials with which to prepare them to bring healthcare costs down. If your people suffer because they don't have access to needle exchange programs, therapy, or counseling, then rehabilitation is healthcare. And not our current end-of-life focused form of rehabilitation, but the full social structures required to help people handle suffering and addiction, or perhaps not fall prey to it in the first place. That's how you bring healthcare costs down. Because single payer is not the goal, single payer is a tool. Health justice is the goal. And when we fight for health justice, we all fight side by side, because economic justice is health justice. Environmental justice is health justice. Reproductive justice for those who want to conceive and those who don't is health justice. And justice for black lives, justice for brown lives, justice for trans lives, justice lives of for all people, regardless of age, gender, race, or creed, that's health justice. We have inherited a world in which your permission to receive healthcare, capital's allowance you can be safe in your own goddamn body, is dependent upon how much a corporation can extract a profit from you. And thus we have permitted in our country utter desolation. Without our consent, we have been forced to participate in the condemnation, criminalization, and abandonment of people in need. People with disabilities got to spend tens of hours a week pleading with insurance companies for a chance to maybe go on a waiting list to receive the care they need, if they're lucky. The unlucky ones got to plead with Medicaid or Social Security to maybe consider compensating their partners, friends, or parents a whopping $1,000 a month for taking care of them full-time. Elsewhere, across America, we have the opioid epidemic, an epidemic whose vector is capitalism itself, originally manufactured as a patent extension ploy with a massive marketing campaign that now kills 180 people a day. And those it doesn't kill are written off as criminals, the untouchable, because only criminals use drugs and they're abandoned and left to rot while their children call their names. People who suffer from chronic pain are pushed to the side, stigmatized, ignored. In life, it is poor and uninsured people who are used to test the drugs that are then turned around and sold to the wealthy and insured. And this servitude continues in death because it is the bodies and organs of the poor that are ripped and sold to the wealthy as transplants. Because there is no end to the body horror of capitalism. There is no line too far for the commodification of the body. America has cheered the privatized slashing and burning of social structures and then has the audacity to punish those who suffer. When people are in need, we waste time, effort, and money means testing, separating the worthy from the unworthy among those who need help, and then stigmatizing them instead of guaranteeing the basic decency of health equity. And this is cyclical. This has happened forever. It will continue to happen so long as we tolerate, even in whispers, the idea that the body is a commodity. And for systematically marginalized people, sick people, homeless people, people battling addiction, people with disabilities, poor people, pregnant people, trans people, women, people of color. Well, when there's no way for the medical industrial complex to find value in their bodies, this is America, and there's always the private prison system ready to receive them for profit. And so single payer is not the revolution. It is our first counterattack in a war that is already waged against us, by which subsequent counterattacks are made possible. It is not only the only reasonable method of controlling healthcare costs while guaranteeing universal coverage. It is the tool by which we force ourselves and force the state to reckon with the racist, sexist, ableist, and classist provision of healthcare in this country and to begin to strive toward relief and articulation of health justice. And so we have an obligation. We stand on the shoulders of hundreds of thousands of nurses, of tens of thousands of doctors, of organizations like ADAPT, and we must build the popular movement which demands single payer from our government and then demands health justice in our nation. Now, realistically, you and I together can bellow into the night and demand single payer morning, noon, and evening all day long from now till 2020. And that's good, and I will do that. Hope you do that too. But it will not provide material relief for people who suffer now. But luckily, this is not an either-or proposition. We have an obligation to ourselves and those we love, now and in the future, to be good neighbors, to be good socialists. We must extend the basic decency of showing up, of going to folks around us, listening, asking questions, listening some more, finding common ground, and then putting our shoulders to the wheel. We must identify what battles we can win, and then win them. We must fight for a continuous spectrum of demands toward health justice. Unlike liberal policy tweak incrementalism, our successes must offer material and redistributive benefits to people who suffer now. And the ways people have taken this fight across the country are many. Back in SF, that is passed right to counsel and an anti-taser bill. In Cincinnati, DSA fought for and won a needle exchange, the first in the region. In Maine, they won Medicaid expansion at the ballot box off of the movement for a minimum wage campaign. In Louisville, Indiana, and Austin, they're fighting for safe housing and safe transit. In West Virginia, the teacher strikes had insurance costs foregrounded. And then back home in Texas, they're fighting for paid sick leave. And in fact, the initial petition drive for paid sick leave in San Antonio turned out 144,000 signatures, which is the largest popular movement in San Antonio in years, if not decades. And I don't know what the revolution looks like, but it required that massive mobilization, like what we saw in San Antonio, like what we saw in San Francisco, like what we saw in the Bronx just last week. Because if we give people something material, they will fight to have it, and they will fight to keep it. If we fight with people today, they will fight with us tomorrow. We build solidarity as a function of building power. And through that power, through that massive mobilization, this is a fight we will win. The tide of history is in our favor. Medicare at all polls at 64% nationwide in favor. This is not a radical proposition among the folks it affects. We are simply discussing a basic principle of fairness. Because we are all fashioned, right, from a formless and shapeless place. We've been thrust through them all and born into a world that is arbitrary and unequal in its allocation of suffering. And yet, instead of affording each other the basic dignities of being human, we have developed this bizarre system of American health finance in which one's suffering is one's own responsibility, in which empathy and listening are vestigial and unnecessary. We have atomized suffering and thus, in turn, assigned blame for suffering to those who suffer. I've seen such naked suffering inflicted in my name. I've seen families ripped apart by the unrepentant, unyielding bloodlust of capitalism. I have seen people torn limb from limb in the service of extracting profit. I have seen the dehumanizing machine all at once, and I felt despair. For me, it is heinous to be an American, to be complicit for my own simple existence in my only and horrible home, in the mass miserization and annihilation of those against whom the whole rotten weight of the world is stacked. And this is intolerable to me. And so I say enough. Not in my name may this America persist. May we root ourselves not in fear, but in love and fury. Love for those who suffer around us, and from that love, may we cultivate the fury by which this cruel machine will be destroyed at our hands. My friends, single payer is moral. Single payer is necessary. And single payer is achievable. Solidarity now, solidarity forever. Thank you.